is going to be what the second exam um of the year for you guys. So we're really going to try to be as detailed as possible, but also concise with our information. We also are going to try our best to answer your questions. Please remember that we are not professors. With all due respect, we are teaching assistants. So if there's something that we do not know, the best thing for you to do is to not only look back at your lectures, but also to inquire from the professors, who actually make the slides and are more well versed in all this. Nonetheless, we are very happy to be here and we're glad to help you guys. So without further ado, we're going to take it away with this foundation exam 2 review. All right, let's get started.
Hi guys, I'm Prerna. I'll be going over the first section, which is just an overview of the metabolic pathways. So the first question, and you can just type in your answers in the chat and any questions that you have, and we'll try to answer them. But yeah, this first question is, which of the following is false in regards to the catabolism pathway?
Seeing a lot of B's.
Yep, it looks like everyone's got the right answer. Perfect. Anyone want to unmute and explain why this is wrong? If not, that's okay too. But yeah, pretty much catabolism is actually stimulated by a low energy charge, and that's because the cell needs more ATP. And anabolism would be stimulated by high energy, that's correct. And then going over the other answers, so for catabolism, the end products would be simple molecules. They're breaking down complex molecules like carbs and proteins and fats, and it is a convergent process, and it's also releasing free energy, so it's exogonic versus an anabolism would be endergonic. And if we go to the next slide, that kind of overviews the differences again. Definitely review these. It's always good to know the differences, and this is likely to come up on your exam as well, so just make sure you're able to know the key differences. All right, next question. So this one is just going over different types of reactions. So let's start with the first one. Which one is transferring a functional group from one molecule to another? Perfect. Yep, that one's pretty straightforward. It's group transfer. So that one would be like ATP donating phosphate to glucose to turn into glucose 6-phosphate. So the next one is rearrangement of atoms to form isomers. Perfect. Yep, you guys got that one. That one is isomerization. Again, another example of isomerization would be like glucose 6-phosphate being transferred to fructose 6-phosphate. Those are isomers of each other. And the next one, electron transfer. Yep, that one is oxidation reduction. And then the next one, addition of functional groups to double bonds or their removal to form double bonds. Yeah, that one is pretty straightforward. The name and type of reaction is, they're already kind of stated within each other. And the next one, cleavage of bonds by the addition of water. Yep, that one is hydrolytic. So that one, an example would be like peptide bond hydrolysis by proteases. And then the last one, formation of covalent bonds. Yep, that one is referred to as ligation, and it does require ATP to perform those two covalent bonds to be formed. Yep. So just make sure again you know all these types of reactions. It's possible for them to ask a question about this as well, and you be able to identify it. But they're pretty straightforward. Let's move on to the next one. All right, which of the following is true about the committed step? All right, yep, it looks like everyone got the right answer, which is C. The committed step is never the rate limiting step, so that is oh, sorry. Yeah, the committed step is generally the target of regulation. So we'll go over the ones that are wrong now. So for the first one, it's actually an irreversible reaction, which is the committed step, right? So when it's committed, that substrate passes a step and it can't easily go back or be used elsewhere. So for example, hexokinase, that step is irreversible but not committed, right? And in PFK1, that is a committed step, right? So from here, the molecule has to go on through glycolysis. And we're going to differentiate that from rate limiting, right? Because rate limiting is going to be the slowest step in a metabolic pathway, and that's going to be controlling the flux of the pathway. But rate limiting could be reversible or irreversible. And in many cases, the committed step is also going to be the rate limiting step. So if we go to the next slide, it also breaks down how to differentiate the two. It's really important to make sure you know important ones that they mentioned in lecture that are rate limiting and committed. So it's just a review of pretty much those concepts. Go to the next slide. All right, so which type of regulation takes the longest? Awesome. Yeah, looks like most people got it. It's D, so that's synthesis or degradation. So this is pretty much like gene expression or protein degradation because it, involves transcription, translation, protein turnover. It's going to be taking the longest because you either have to make or destroy the enzyme. And then the other options listed are definitely shorter, ranging from seconds to minutes. But synthesis or degradation, anything involving gene expression is definitely going to take the longest. And then, yep, that's just a little chart from your lecture to review that again. All right, and then another question. So in an enzymatic pathway, enzyme A converts substrate S into product P. If there's high levels of P that bind to an enzyme A and reduce its activity, what type of regulation is this an example of? Amazing. Looks like everyone got B. So they definitely like to test your knowledge of differentiating between, competitive inhibition, product inhibition, allosteric activation, and cofactor dependence. So we know that this is product inhibition because, the end product of that reaction is binding the enzyme and it's going to slow it down. It's that feedback inhibition to prevent any overaccumulation of the product and to just maintain homeostasis. And to go over the other options here, so competitive inhibition, again, is when a molecule is going to bind to the active site of an enzyme. So it's going to compete with the substrate. And then allosteric activation is when a molecule is going to be binding to an enzyme at a site other than the active site, and it's going to be increasing the activity of it rather than inhibiting it like we see here. And then for cofactor dependence, they definitely like to highlight a lot of important cofactors for this exam. You usually can see them on your metabolic map as well, so it'll be helpful if you ever need to refer to important cofactors, definitely look there. But usually, some enzymes will require a non-protein molecule to function properly, things like metal ions, like magnesium, zinc, iron, or organic molecules, such as like NAD+, FAD, vitamins. So without that cofactor, the enzyme might not be able to catalyze the reaction. All right, we'll go to the next one.
I'm sorry, just really
Mhm.
fast. How do we, um, is there any like keywords in this question that kind of make you be like, yes, this is definitely product inhibition versus the other choices?
Yeah, so for this one, that's a great question. So here we see that the product is reducing the activity of an enzyme, right? So because there's high levels of the product, right, you're gonna want feedback inhibition pretty much. You don't want to have overaccumulation of that product. So in this question, we see that there's high levels of the product being made and it's binding specifically to the enzyme to reduce its activity. So it's kind of in the word of the term, it's showing that the product is being inhibited because there's an overproduction of it, if that makes sense.
Yes, thank you.
Of
I had,
course.
sorry, and staying in the same question. So if this was out, I'm sorry, if this was allosteric inhibition, could that have been a potential answer or no?
Yes, that could have been. Allosteric activation would be increasing the activity. Allosteric inhibition could also be a correct answer here if that was an
Okay.
option instead.
Okay, thank you.
Yep, of course. And then here is from your slides as well. This is again showing product inhibition. So we have an example here. If you have glucose 6-phosphate that's accumulating, it's going to inhibit the enzyme hexokinase. All right. All right. That's it for my section. We'll move on to Kevin's.
Hey guys, we're gonna be doing thermodynamics. Right. So these are just the objectives from the lecture. I figured that it would be important for me to plaster it on there just so that you guys are aware of the things that will be on the lecture and also that may be tested. All right, first question. What is the first law of thermodynamics? Ooh, I'm seeing a mix of C's and A's. Everyone look at what Joseph put in the chat. He said read C carefully. Yeah, yeah. Uh-huh. Okay, okay. You see? That was okay. Oh, never mind. So this was I purposely did this just so that we can gauge how good the test taking skills are, right? It's not enough to just know like the lecture slides. You also have to know how to take the test, all right? And when it comes to taking the tests, no, you are not illiterate. Don't say that. Yes, exactly. You have to be able to read the answer choice carefully and also understand what the question stem is asking you, right? The first law of thermodynamics is that the total energy of a system and its surroundings must remain constant, right? And this is proof from the lecture slides on the bottom right corner saying that, right? Um, yeah, so B is obviously the opposite of A, so that can't be right at all. C is what a lot of you guys were choosing, which is incorrect because energy cannot be created or destroyed. It can only be transformed into a different form of energy, right? And what's delta G? Is delta G endergonic or is it something else? If delta G is negative, sorry. Yeah, if delta G is negative, it's going to be exergonic. Okay, good. So we're good with that. Okay. Next question. A chemical reaction has been given for you to analyze. The free energy of the product is 3,600 joules, and the free energy of the reactants is 7,200 joules. What is a change in free energy? I'm seeing a lot of E's. Can somebody explain how we're getting E? Oh, I'm seeing C's as well. I'm not going to say the answer yet, but I just want someone to explain why they think their answer is the answer. Yes, it's gonna be products minus reactants, not reactants minus products. Be very careful with that. All right. I'm just gonna be very honest with you here. These faculty members are not gonna be afraid to put questions like that on the test to pick at your brains a little bit, right? You have to be able to know how to calculate these things. It's product minus reactants. So the product is 3,600 joules, reactant is 7,200 joules. That'll give you negative 3,600 joules. All right. Yeah, and okay. Yep, it's you. Let's go for the next question. You are given a reaction and are told to calculate delta G. The reaction is that sodium chloride is being broken down into its ions Na and Cl. Delta H is 1000 kilojoules per mole. Delta S is 200 kilojoules per K times mole or Kelvin times mole. And the temperature is 370 Kelvin. What is delta G? First off, before you even answer this question, what formula do you need to use to solve this problem? Before we even look at answer choices here, what formula do you need? Yes, you need delta G equals H minus, yeah, exactly. So then what's the answer? I see one vote for A. There's also a calculator on the test, so you don't have to worry about like any like unless they took it away, then they're really screwing with you guys. But the last time I checked, there is a calculator. And it's A. Good. It's A. All right. This is just simple. If you know the formula, then you can easily just plug in the values and then answer the question. Okay, moving on to enzyme and enzymatic kinetics with Gabby.
Hi guys, I'm Gabby. I'm going to be doing the enzyme and enzyme kinetics. Thanks, Kevin.
Wait, someone had,
Um,
sorry. You said what do the variables stand for again? Okay, so delta G is free energy, delta H is going to be enthalpy, and delta S is entropy. You should also know what those terms mean. Are we good? Okay, I guess we're good. All right. Take it away, Gabby.
okay, hi guys. I'm Gabby. I'm going to be going over a couple of topics. We're going to start with enzymes and enzyme kinetics. So we'll start with the first question. Kind of long, but a 1-year-old boy is diagnosed with a rare inborn error of metabolism. He has an abnormal form of a lysosomal enzyme that catabolizes phospholipids. His cells are analyzed. The rate of phospholipid breakdown by the enzyme is determined at various concentrations of phospholipid. What is the best estimated Km? Yes, there's a lot of math. I got one answer. No, they don't give you formulas on the test, unfortunately. Anyone else have any answers for this? Okay. Yeah, that's the formula. Km equals 1/2 V max. Don't forget the V. All right, so I guess a lot of people got B, so we can move on to the next slide. So since the V max 1/2 V max is equal to Km, which is what we're looking for, we see V max being 6.25. We have to find 1/2 of that, which is 3.125, and that is not really on this chart, right? The closest thing to that is 3. So if you look at the Km, the 3, it's 2.0. But what we found for Vmax times 1/2 is 3.21. So we have to go a little bit higher than the Km that's given for 3. So that would be 2.1. I hope that made some sort of sense. Does anyone have any questions about this?
Is there
I'm
any
sorry,
way?
sorry, go ahead.
I was going to ask probably the same thing. Can you write it out by any chance? I don't know if you have access to the.
Yeah.
It's like hard to visualize if you're just saying it out loud.
Yeah, because I didn't understand anything that you just said. I'm
Oh,
sorry.
damn. I'm sorry, guys. Okay, I put it in the chat. But yeah, so 6.25, you have to divide it by 2. You get 3.125. 3.125 is not a Vmax seen on this chart. You see 3 instead, where it says moles over minutes. But since 3.1 is slightly higher than 3, and you're looking over to the grams per milliliter side to find the Km, you have to go a little higher than 2.0 because it's just a little bit greater. I think I definitely saw a table on our test like this where it might not be these crazy numbers, it might be more specific. Like instead of 6.25, they might just do 6, and then you divide 6 by 2 and get 3, and you just look across the table and the KM would be 2. So that would be your answer.
It's leaving it.
Is there a reason you chose 2.1 versus 1.9?
Yeah, so 1.9 I would choose if the Vmax ended up, 1/2 Vmax ended up being something less than 3, like maybe 2.9 or 2.8. Because then the KM would be a little bit less than what's on the table.
Okay, thank you.
Mhm. Okay.
No.
All right, so we'll do this question next. Do you guys want to read it? Okay, we have one for A. Does anyone have any other answers? Okay. I feel like I'm seeing a lot of A's, so that's good. Um, so yeah, A is the correct answer. Um, yes, C would be hexokinase. I was getting to that. But do you want to tell me why C would be hexokinase? Right. Mm-hmm. Yeah, exactly. So A is showing glucokinase, which has both a high Km and a high Vmax. That's why that curve is going very high up on that chart. And then C is hexokinase because it has both low Vmax and low Km. And so that's going to be more involved with, like red blood cells, and they're going to use hexokinase more. Is D first order. I made up those other two, to be honest. So I wouldn't really put an enzyme to it. But yeah. This is just some more details on glucokinase versus hexokinase. Um, yeah, and like how hexokinase works yeah, that's fine. In other tissues versus glucokinase is in the liver. And the way I remember that, glucokinase has an L in it and L for liver, but yeah. Okay, we can move on. Okay, diflunisal is a drug used for treating pain and is classified as a competitive COX-2 selective inhibitor. Which of these represents the kinetics of diflunisal inhibition? Mhm. Okay, I'm seeing a lot of D. Yes, you have to read if it's with or without. All right, so I'm seeing a lot of Ds. So yeah, so competitive inhibition, you usually see the drug, with the drug, the line would be pointing towards a higher Km on the x-axis, and the Km would stay the same. I mean, the Vm would stay the same, sorry. So the x-axis is going to be your Km, the y-axis is going to be your Vm. And then if you have a non-competitive inhibition or suicidal / irreversible type of inhibition, what do you think you're going to see? Right. So it's not really on this in this example, but yeah, exactly, yeah,
KM
none
is
of
the
them.
same. KM is the same, but Vmax is different.
For competitive, KM is higher, so it moves towards the right, and VM is the same. but for non-competitive, KM is the same and the Vmax is lower. Yeah.
Yeah, that's what I was saying. Isn't that what you were
Okay.
asking? Okay.
Oh yeah, I was just reading the group chat. Sorry.
Oh, sorry.
Also with the answers. Yeah. Okay, but you're right. And that's the same with suicidal slash irreversible inhibition. Okay, we can move on. Okay, this is just kind of like a summary of everything, non-competitive, competitive, um, and where the KM, VM is. This is also just if you need it in a chart form. And also we know that suicidal inhibition, you can't have like a lot of substrates to overcome inhibition because of covalent binding. So it's irreversible. It's not going to move from there. It's just going to stay where it is, regardless of how much substrate you're putting in. Okay. Next, we're going to move on to the electron transport chain. So this question is going to be a little bit long. I'll give you guys a minute. Okay, I'm seeing a lot of D. All right, so D is correct. Basically, this man is suffering from carbon monoxide poisoning after being engulfed by his car's exhaust fumes. And carbon monoxide, we know, is a direct inhibitor of complex 4 along with cyanide. If you go to the next slide, I'll talk about it a little bit more. So this is just a slide of all the inhibitors and uncouplers from your lecture. The way I like to remember the inhibitors of the electron transport chain complex is so for like rhodonone, like it has a 1 at the end. So I associate that with complex 1. Antimycin, I think, and trimycin, tri for 3, so complex 3. And then CO and cyanide. So the abbreviation for cyanide is CN. CO and CN both have 2 letters, and the Roman numeral for 4 has 2 numbers. So that's how I remember those. But yeah, so oligomycin's inhibitor oxidative phosphorylation, and then you have to know the uncouplers as well. If you want to go on to the next slide, is a chart. Okay. So everything here should be decreasing with the inhibitors or uncouplers, except for the electron transport chain function, oxygen consumption of uncouplers, and that's because the uncouplers increase the electron chain function and oxygen consumption by bypassing ATP synthase. So you're decreasing ATP production. The protons flow back into the matrix and without making any ATP. So the electron transport chain tries to compensate the proton gradient. And so it speeds up the electron flow to try to reestablish it. Faster electron flow causes increased oxygen consumption because the complex 4 is working harder to reduce the oxygen to water at the end. Does anyone have any questions about this? Okay, we can move on. Okay, algomycin X. Yes, okay, sorry. Algomycin X as an inhibitor of phosphorylation. Okay, good. Everyone's saying B. Yes, amyl nitrate or thiosulfate sulfate is correct. So 100% oxygen and hyperbaric chamber, those are both treatments for carbon monoxide poisoning. Amyl nitrate, nitrite works on oxidizing the reduced form of iron to Fe3 plus. And barbiturates is obviously an inhibitor of electron transport chain complex 1. If you go to the next slide, you have a picture from your lectures. So carbon monoxide versus cyanide, what causes it, and the treatments. And you could see under treatments, amyl nitrite and sodium thiosulfate are both involved in cyanide poisoning. Yeah.
Hey guys, I'm back. We're gonna be doing signal transduction, okay? These are the objectives from the lecture. Again, anything concerning these objectives are fair game for the exam. So if you're someone who likes to go through the objectives in order to tailor your studying, this is for you. First question. Cortisol is a hormone that is responsible for a variety of functions, such as blood sugar regulation, inflammation control, and blood pressure maintenance. It exerts its effects by binding to a receptor and initiating a series of signal transduction pathways. How does cortisol reach its receptor? Seen a lot of B's. Okay. Yep. It's B. All right. So cortisol is fat soluble. So cortisol is fat soluble. That means that it can diffuse through the plasma membrane, right? Remember that the plasma membrane is mainly fat, right? And cortisol can diffuse through and bind to a receptor either in the cytoplasm, or there's even some cases of like other fat soluble hormones binding to receptors in the nucleus, right? So it's fat soluble, so it doesn't need a membrane receptor, right? And the other two, I just made them up. So it's B. And this is basically saying what I just said, right? Okay. After injecting glucagon in a mouse, blood was drawn and it was discovered that the mouse has increased CAMP levels. Which receptor would glucagon have to bind to in order to have this effect? A lot of D's. If I said that the answer was A, why would that be wrong?
Is it because A is inhibitory, so you would have decreased cyclic AMP?
Good. What about B? Someone else. What about B? Yeah, IP3 and DAG, exactly. It's not enough to know what G alpha S or G alpha I or G alpha Q is. You need to also know the secondary metabolites that are involved in those pathways, right? So it is D, right? Good. And this is basically the slide that's giving you some of the hormones that work on these adrenergic receptors, right? Okay. Which of the following statements is false? Ooh, I don't see answer choices. Which of the following statements is false? Guys, false. Oh yeah, you guys are gonna be mad at me for this one. Can someone explain to me why E is the answer?
Is it because cortisol is a steroid hormone? So it
Yeah, it's a steroid
dissolves
hormone,
through?
so it just diffuses through the membrane. It does not have a membrane receptor. You find membrane receptors with what kind of hormones?
Hydrophilic?
Yeah, hydrophilic, aka your peptide hormones, right? And insulin is a prime example. Insulin is a peptide hormone, right? Good. So, and um, A and A and B are totally false, right? Because we've already seen from another slide that epinephrine binds to both alpha and beta receptors. And GTP, when it's bound to GTP, I mean, sorry, when the G protein is bound to GTP, it's active. What would be the case for an inactive G protein? What would they have to bind to? No significant past medical history, presents with low abdominal pain. He explains, sorry. Okay. He explains that he suffers from diarrhea. Okay. He explains that he suffers from diarrhea. On physical examination, he is very lean and dehydrated. A stool sample was taken, and Vibrio cholera. Again, Vibrio cholera was discovered. This microorganism caused the diarrhea by doing what? A lot of A's. Good. Correct answer is A. But before I move on, what's B? B is pertussis, right? C is aspirin. Good. How does so pertussis, the toxin, what does that cause? What condition? Whooping cough. Exactly. Good. So by ADP, we're ribosylating G alpha I. What is it specifically doing to G alpha I? Yeah, exactly. It's inhibiting it, right? So that means that G alpha I can't decrease the level of CAMP, which means that CAMP is going to increase, right? Good. So both of these methods increase CAMP in some specific way, right? And C is aspirin, right? You're gonna learn that later if you don't know that now. C is aspirin, right? All right. And this is basically what I was talking about. Okay. A 26-year-old man presents with a mild headache. Sorry, there's a question. What dictates which receptor epinephrine will bind to? Let me see. What dictates bind to? It all depends on your body's metabolic needs, to be honest. Um, and also epinephrine. Sorry, let me actually go back to that slide. Damn, guys, you guys so damn fast. But yeah, it's definitely C. All right, hold up. Let me just answer this question. Depends on your body's metabolic needs, and also epinephrine doesn't really have a preference. It'll bind to both alpha and beta. Yeah. And yeah, it's definitely C. What's the condition? What is the condition? Chondroplasia, exactly. What is A? Does anyone know what A is? A is Marfan's. Good. What condition, what symptoms do you see in Marfan's? Yeah, everybody's tall. I mean, yeah, exactly. Long limbs, very lanky. Yeah. There's a very big, yes, I was just about to, thank you, Rachel. I was just about to ask that. Most of these Marfan's patients die because of aortic aneurysm and aortic dissection. All right. Okay. All right. Let's move on. We're gonna do macronutrients, specifically carbs, proteins, and fats. All right. Okay. So it says a physician is trying to calculate the total energy expenditure, or TEE, of one of his patients. He forgets the formula needed to do so and asks you. You answer by saying what? What is the formula? A. Okay, a lot of A's. Good. A lot of A's. This is just you know it or you don't type of thing, right? The formula is going to be total energy expenditure equals the basal metabolic rate times the activity factor. All right. Okay. And this is just a slide explaining that. Yeah. Okay. Let's move on. A 5-year-old child is brought to the hospital due to severe influenza symptoms. Okay. Severe influenza symptoms. His vitals are 102.5 degrees Fahrenheit, 99 beats per minute, 90% is his SpO2, and his blood pressure is 101/75. On physical examination, the doctors noticed that the boy had very slim arms and a prominent belly and poor wound healing. Physical exam findings most likely describes which of the following symptoms? Yes, it's B. It's kwashiorkor, right? What would you find in A? Yeah, you would find wasting, muscle wasting. That's a very big symptoms of marasmus. Yes. They're very, very slim, right? Would not have a prominent belly, exactly. Right? So does anyone know what C is by any chance? It's okay if you don't. I'm not gonna test it. C is basically the latter stage of a syphilis infection, Tabes salus. This case, you're gonna lose like sensation in like your hands and your feet. They're not gonna test you on C. I repeat, they will not test you on C. Unless otherwise said, but they should not test you on it. They're not going to. This is just a random answer choice, so please don't get scared, okay? So with E, exactly, it's a good thing. It's a good thing you asked that. So E, right? E does happen in kwashiorkor, right? That would explain the edema. However, the overall condition is kwashiorkor, right? And this is just basically the slides showing that. Okay. I think this is the last question. Let's see. So a 62-year-old Asian American man is brought into the emergency room for some digestive issues. After a blood test, the physician on call notices that he is having trouble absorbing fat-soluble vitamins. What might the man have eaten in excess to cause this? What vitamin might have been malabsorbed? Ooh, I see I stunned a couple of people, huh? Question marks, question marks, a lot of question marks, a lot of uncertainty and not enough certainty. If you know your fat soluble vitamins, you can literally, yep, someone just gave you guys, yep, okay. So now a lot of, very much all over the place. Okay, let's move on. Let's see. Okay, so again, your fat soluble vitamins are going to be A, D, E, and K. Remember these fat soluble vitamins for the rest of your life because they're gonna come back eventually, right? The only other thing that you needed to know was that when you eat soluble fibers in excess, that can inhibit your ability to absorb fat soluble vitamins. Yeah. Okay. Good. So okay. So, yeah, we're doing carb structures now. Does anyone have any questions? Okay.
I'm sorry. For that one, why wasn't it A? For the most the
So, as I said before, this is a two-part question, right? So I explained the fact that when you eat soluble fibers in excess, it can actually inhibit how much of the fat soluble vitamins you can absorb. It also says that verbatim in your lecture. However, with vitamin B12 is not a fat soluble vitamin. Your fat soluble vitamins are going to be A, D, E, and K.
Okay, thank you.
No problem.
Can you just
Anyone else?
explain what happens with insoluble fiber then?
Insoluble fibers, let me see. Actually, let me just fix my Wi-Fi. Sorry. Uh, okay. I'm back. Okay, so with insoluble fibers, this is what this doesn't inhibit your fat soluble vitamin absorption. Only fat soluble fibers do.
Thank you.
Yeah. Okay. Okay, let's go through carb structures. Okay. This is to pick at your brains a little bit. So don't be confused. Well, at least not don't be confused, sorry. But don't be anxious if you're confused. All right. So which of these, which one of these is a disaccharide? Disaccharide, disaccharide. I see one answer choice, so that's already wrong because there's two. Oh, three? All right, you ODing. It's not three. It's only two of them. I see C, D, and E. First of all, when you see this suffix saccharide, what are we talking about? What macromolecule? You're talking about carbs, right? Sugars. Okay, good. So when you see this prefix di, how many sugars are we talking about? Two, exactly. So we're talking about two sugars that have been put together. Okay. So then two monomers that have been put together. Exactly. So then which one? I'm seeing C, D, and E. Okay, let's move on. It's C and D. Those are your disaccharides, right? Yeah, exactly. Mannose is an epimer of glucose, right? Did you guys go over what epimers are? I'm pretty sure because according to your slides. Okay, good. So because I don't want you to I don't want to confuse you guys with terminology. Yes, but glucose is a monosaccharide, one sugar, right? Cellulose is considered what? What is it? Yeah, it's a polysaccharide. Mm-hmm. Polysaccharide. E is a E is what? Mono, di, tri, poly. What is it? It's a monosaccharide. Good. What about F? Because I saw someone pick F. Yeah, it's a monosaccharide, right? This is just you know it or you don't type of thing, all right? And this chart is very helpful. Okay. Okay. Which one of these correctly describes a chiral molecule? Mannose is an epimer of glucose. Hmm. And people said organic chemistry wasn't going to help in medical school. Good job, guys. A chiral molecule is a carbon that is that's linked to four different atoms, right? Okay. All right. So you are working in a lab and you found a sugar compound that can convert into a ring. With further examination, you realize that the sugar has 6 carbons. Which of the following terms correctly defines the substance you are looking at? So a 6 carbon ring is basically saying what is a 6 carbon ring called, right? And a lot of you are picking A, so A is the right answer. The way that I personally think about this is that a furanose starts with the letter F, just like how 5 starts with the letter F. And there's 5 carbons in a furanose ring. All right. Okay. Okay. carb digesting, and transport. Wait, Daphne, what do you mean by is this sucrose?
Furanose ring, is that sucrose?
So sucrose is a disaccharide.
So is it fructose that's a furanose?
So furanose just describes furanose just describes a single monosaccharide ring that has been transformed into a single monosaccharide that has been transformed into a ring, right? They're just carbon rings.
Uh-huh.
That's basically that's the general term.
I guess
Sorry.
I'm just trying to figure out, is there an example of a furanose sugar?
Yeah, you can just basically fructose can be one of them. You can make fructose into a ring. You can make glucose into a ring. You can make
Okay,
any
got it.
monosaccharide into a ring, right? Yeah,
It
orgo trauma, right?
Okay,
depends on
thank you.
how many carbons are in the ring,
Yeah, exactly.
not how many
That's
carbons are in the molecule. Just
yes. Yeah. So that literally
Thank
just what she said,
you.
right?
Perfect. Because I was like, is there an example? Like,
yeah, fructose can be a furanose or a pyranose, I believe. It can make a 5 ring or a 6 ring.
Let's see,
thank
carbon
you so much.
digestion. Are we good? All right, I'm moving on. Carb digestion, and transport. Okay, long question. Get used to long questions, please. A 56-year-old man with a past medical history of prostate cancer came into the hospital to get a regular checkup. He was referred to the gastroenterologist because he felt an abrupt pain in his abdomen. His vitals are within normal range. After thorough examination, it was discovered that his pancreatic duct is blocked. What would his body struggle with considering this blockage? Let me check the answer choices. Yeah, I see a lot of E's. It's very good. All right. Yep. It's E. All right. So, yeah, it's E. So what organs in the GI tract, just out of curiosity, which organs are responsible for churning food? Stomach. Yeah. Stomach is a big, yeah. Yeah, good. So now, and also another thing about these exams is that some of these answer choices are very obvious in terms of them being right or wrong, right? If we're talking about the pancreatic ducts, you should nowhere in hell ever give me an answer like delivering the salivary amylase, right? Because that comes from the salivary glands, all right? That's in your saliva, which is in your mouth, not your pancreas, right? Yeah, what produces pepsin? Yeah, pepsin is in your stomach. All right. Good. All right. Okay. So after eating a boatload of sugar, the kidneys are on overdrive. There's a specific protein that is responsible for there's a specific protein that is responsible for most of the sorry. There's a sugar that's responsible for reabsorbing most of the sugar that is filtered through the kidney. Which of these is it? Okay, a lot of people are saying C, right? C. Okay. Yep, it's C, right? Okay. Yep, it's definitely C. And SGLT1, it reabsorbs sugar, but not most of it. It's only like 10%. All right. What do the other glute transporters do? What does glute 1 do? Okay, glute force for insulin. All right, let's take it let's take it one at a time. One at a time. What does glute 1 do? Yes, RBC and fetal brain. Yeah, good. What about glute 2? Yeah, exactly. It's gonna transport glucose in and out of the liver and kidneys basically, and into pancreatic ducts. What about GLUT3? Yeah, it transports into neurons. It's gonna feed your neurons basically. Now everybody loves GLUT4. What does that do? Yeah. Now GLUT5. Yeah. As soon as you see GLUT5, just automatically think fructose. All right. Okay. Let's move on. According to the previous question, what might your doctor recommend you to prevent your sugar from spiking? According to the previous question. Previous question. And C is the correct answer. Your Flozins, right? You're going to be seeing a lot of drugs throughout your life since you guys are going to be doctors. So it's very good for you to try to group them up in terms of function, right? A lot of these drugs have the same suffix. Like Flozins would be like your SGLT2 inhibitors. Anything that ends in mycin is most likely an antibiotic, right? Your Flozins are going to inhibit SGLT2, which is going to prevent that sugar from being reabsorbed into the bloodstream, right? Okay. So a medical student is manipulating protein function in rats. He notices that whenever he blocks a certain protein, fructose absorption in the intestinal cells is depleted. What is a protein? We just went through this. I see a lot of C's. Why is it not D? Yeah, C is the right answer. Okay, I have a question. Can you explain GLUT versus SGLT? I'm a little confused about the difference. Okay, so yeah, it's a good thing we got to the slide because these are the functions. So SGLT2 and SGLT1, these are gonna be important for the symport transport of glucose in terms of the reabsorption. And then your GLUT transporters are basically gonna be moving glucose in and out of certain organs. Um, yeah, and also remember that your GLUT transporters are mainly passive. Your SGLT2 are going to be ATP dependent, which means that they're going to need energy. All right. Okay. A 35-year-old patient suffers from diarrhea and bloating whenever he consumes milk. His doctor says that he has primary lactose intolerance. Which of these would happen in the patient's intestine? All right. See a lot of people are picking B, and it is B. Good. All right. Remember that lactase is going to be breaking down your lactose into glucose and galactose, right? Without this, lactose is going to remain in the intestines. And remember that water follows solute. So wherever there's a lot of solute, water is going to come in to basically make that equilibrium in diffusion. So that's going to cause a lot of water to come into the intestine, making your diarrhea, right? All right, so primer 11 is nutrition. Okay. How much water does adipose tissue have? Like basically, what's the water composition in adipose tissue? This is basically a you know it if you don't. You know it or you don't type of question. Yeah, I dare one of you to pick 15.5. Yeah, it's C. It's 15, right? It's basically you know it or you don't type of question, right? So adipose tissue contains about 15% water. The muscle contains about 80% water, right? Okay, so I just did that to pick at your brains a little bit. Just it's really nothing. Just need to go according to what the slides are saying. That's basically it. All right. So track runner is starving because he just ran a 5 mile race without eating breakfast. In order to keep him from going into hypoglycemic shock, what does the body most likely do first to compensate for the sugar loss? A lot of B's and D's. Be very careful with this. What does the body do first? First, first. Pay attention to that word first. Okay, can someone unmute and explain why they think their answer is the answer?
Um, I thought it was B because the question says he already ran the 5 mile race. So
Yeah.
wouldn't his muscle glycogen already be depleted? So
Mm-hmm.
after the race, it would go into the liver glycogen.
Mm-hmm.
Like during the race, yes, the muscle glycogen gets broken down first.
Yeah. Anyone else?
Isn't liver glycogen isn't the liver the only one that can raise your blood glucose? Like your muscle can't do that.
Definitely onto something here, right? So B is definitely the answer. Now, because you need your glycogen, right, to preserve energy for contraction in your muscle, right? Um, I saw someone pick A. Why is A wrong?
Because A is only after the fact, like when this he has like no more left and he doesn't even have like anything
Yeah. A is the very last resort, right? Your very
after
last resort.
gluconeogen. Yeah.
Yeah, exactly. A is your very last resort, right? Okay.
Like
Calculate the basal.
A would be like under like long periods of starvation more,
Yeah,
no? Like not
exactly.
necessarily a day.
Long period of starvation. So would you see that in marasmus? Yes or no?
Yeah.
Yeah, you will see that in marasmus. You see that the connection with the diseases, you need to be able to connect certain terms and details, right? It'll help you to answer questions. All right.
Thank you.
Um, just back to so my explanation was wrong, right? It wouldn't be muscle ever because they only supply for contraction, not for the blood glucose, right?
It'll be partially correct because I said what would be depleted first, right? And that's your liver glycogen is usually the first to go.
Okay.
Yeah. Calculate the basal metabolic rate of a 100 kg male. Damn, that school got me tired, man. Shit. Let's see. A lot of these. All right. Yep. Correct answer is D. Right. The correct answer is D. What would you do if I asked you to calculate the basal metabolic rate of a 100 kg female? Yeah, you have to multiply that by 0.9. Exactly. Yeah. Okay. Good. Back to you, Gabby.
I think somebody has a question about why.
About why what?
Um, they just said, can you explain where the 24 came from?
Let me see. I'm trying to go to that question. Where the 24 came. Oh, that's just a part of the formula. It's 24 times 1 times your weight in kg. That's if you're a man. And if it's females, then it's going to be 24 times 0.9 times the weight in kg. Are we good? Thumbs up, down, sideways. Yeah, 24 is just a constant. It's a part of the formula. Okay. I guess we can move on.
Okay, hi again. We're going to be doing glycolysis now. Yeah. All right. So first question, a 35-year-old woman is admitted to the hospital with acute pancreatitis. She undergoes an endoscopic procedure for which she has to fast. 2 days after the procedure, she consumes apple juice. Which of the following enzymes will become more active in the liver cells at this time? So when she consumes apple juice. Right. Okay, so I'm seeing a lot of D. Yeah, PFK1. Okay, so I just underlined the main word to look at when reading this question. So yeah, PFK1, the rate limiting enzyme in glycolysis, is going to be active because that's when insulin's working when you're in fed state. Does anyone know why A is wrong? Okay,
Is that for gluconeogenesis?
yeah.
Okay.
So in the fed state, insulin rises and turns off gluconeogenesis, obviously, so enzyme activity will decrease. Does anyone know why B is wrong? I don't know if they, okay.
So that would be if you need to access your glycogen stores, or if you're, yeah,
Right.
that would be, yeah. So we're looking to activate glycolysis, not the glycogen path.
Right, exactly. Yeah. So B would be active during glycogen breakdown. So when you're in the fasting state, and for more than a day, you deplete your glycogen stores. So it won't be active when you're consuming carbs. Glucose 6 phosphatase, we know that breaks, that releases glucose into the blood. So that's going to increase your blood glucose concentration. So that's not going to be active. And then does anyone know what E is? Kind of random.
Isn't that for cholesterol synthesis or something?
Yeah, it's from cholesterol and fatty acids, but they're not consuming any fats or anything like that, so it wouldn't be active during carb metabolism. Alrighty, we can move on. Okay, during a single cycle of glycolysis, which of the following correctly lists the number of ATP molecules consumed, produced, and the net yield? So in that order, endergonic, exergonic, and net. Okay. B, and now it's all E's. So yeah, we can go back. Okay. So a lot of people are saying E, which is correct. So one ATP is consumed with hexokinase, another ATP is consumed with phosphofructokinase, which gives you 2 ATP in the endergonic stage. During the exergonic phase, 2 ATP are produced with phosphoglycerate kinase. And then also another 2 ATP are produced with pyruvate kinase. So that's 2 in and 4 out, net yield of 2. Is everyone good with that? And I think somebody wanted to go back to the last question, so we can go back for a sec.
Okay, so that was me. To preface, this is not one of the lectures I went over, or maybe I didn't. It's a concept gap. So, so if you don't know how to answer this, is there any way you can use the map to get the
Oh,
answer to
yes, of
this question?
course. This is more of a question I would use the map for, to be honest. If you don't know every single enzyme in the pathway, that's okay. a lot of people use the metabolic map for this type of stuff because it has all the enzymes listed there. So you can
So
definitely figure it out that way.
so the logic for this one would be is we're going to be looking at like how glucose is broken down. So like it's the same
Yeah.
thing. Where in the map would I look for this part?
It would be in the glycolysis gluconeogenesis area. I think it's red. I'm pretty sure, or like pink or something in that area. I'm not really sure what color it is. But
Are we allowed? Sorry, are we allowed to print out the map?
no, they're gonna have it on the exam for you, like on the exam soft or exemplify, whatever it's called. It'll be under attachments and you'll see like a number one. So for one for attachment, click on it and it'll open the whole thing. There's a little magnifying glass that you can use. And then you can press the plus button at the bottom to zoom in. So it'll be easy access. You'll be able to look up phosphofructokinase 1 or whatever glycerol kinase and see where they are on the map and then figure out from there your answer. Yeah, exactly. Apple juice, I just meant carbs in a fed state, insulin's active, so you're going to induce glycolysis. Yeah, exactly. Okay. Does that answer your question?
Yes, absolutely.
Okay, great. We can move on. Everyone understood this with the endergonic, exergonic ATP net. Okay, great. We can move on. Now we're going to talk about PDH TCA cycle. Each of the following cofactors are required for the PDH complex function except.
Quick question.
Yeah.
Since we didn't do like, is the highest yield stuff from glycolysis like ATP, how much ATP, and knowing like PFK and hexokinase? Would you say like
No, there's definitely more stuff to look at. I would just look at the objectives and go from there. I just put a couple of questions because glycolysis has a few things, but
mhm,
I feel like they're going to ask a lot of the
like
enzymatic questions that you can find on the map. But I don't
okay,
know if anyone else, like Kevin, has something else that they saw on the test about glycolysis specifically, if you want to pitch in.
like would it go so downstream
Okay.
from like glucagon and like the GPCR pathway and protein kinase A and how that like would inhibit glycolysis? Like, is that the like depth of knowledge
I'm
that they're
sorry. Could you,
testing, or probably not?
I
I'm
didn't
not
hear
entirely
you.
okay. She had a question on like the depth of knowledge that you need for this test, since I only did questions on like the enzymes of the pathway and then the or like what's active during the pathway and
Mhm.
the ATP molecule net. So she wants to know if there's going to be more on glycolysis.
Oh, I mean, since we're not particularly the ones who necessarily make the tests, we can't really give you a concrete answer. However, what I will say is that anything on those lecture slides that are bolded, red and blue, or anything on that objective sheet is definitely going to be fair game for that exam, right? So they can test you on anything on those lectures, from like the enzymes or even how many ATPs are being consumed in a certain metabolic pathway, right? So it really just depends on how they feel like they want to test you. You just have to know the material, to be honest. That's something that sucks about biochem, you know?
Okay. So I'm seeing a lot of answers for A in the chat. Just good. All right, we can move on to the next slide. So yeah, A is not right. Do you guys know what that's part of? What that cofactor is for? Yeah, the pentose phosphate path. Good. So which cofactor is missing from here? Right. Acetyl CoA. Well, there's CoA up there, pantothenic acid. I think somebody did say it. TTP. Yeah. So it's thiamine that's missing, which is vitamin B1. These are also these four that are correct, along with thiamine, are also involved in alpha ketoglutarate dehydrogenase function, and I believe the branch chain keto dehydrogenase enzyme also. All right, we can move on. This is just a summary slide, the five cofactors that you need. Great. Okay, correctly match the TCA step with products yielded. This one I'd say 100% use your metabolic map. This, I feel like it's difficult to remember each and every type of substrate that's yielded. Yes, you have the metabolic map on the exam. Okay, I'm seeing a lot of C. Yeah, you won't get lost in the sauce. You'll be fine. So yeah, C is correct. This is just going through the entire TCA. If you go to the next slide, it'll better describe it. Yeah, so here's the whole TCA cycle, and I basically just switched up the substrates that were produced. So A would have produced NADH, which was so malate and oxaloacetate malate produces oxaloacetate and NADH. Alpha ketoglutarate produces succinyl-CoA and NADH, not ATP. Fumarate produces only L-malate, not FADH2. And then succinate produces FADH2, not NADH. And that's all here. And you will see this map. You will see this on the metabolic map. You can move on. Yes, mnemonics are good. Okay, which of the following plays a role in both the TCA cycle and the electron transport chain? Okay, everybody's saying D. Yeah, so D is the correct answer. If you go back to the last slide, yeah, it's at the bottom, it's number 6. You can see it's part of the TCA cycle. Succinate dehydrogenase is also known as complex 2 of the electron transport chain. So that is why D is correct. Okay, we can move on. And now we're going to move on to gluconeogenesis. So first question, what are the main gluconeogenic precursors? Okay. The electron transport chain, so you'll see like glycolysis, gluconeogenesis all in the top, and then underneath it is the TCA cycle, and then right underneath it, you'll see the electron transport chain all the way at the bottom. Yeah. Okay, so a lot of people put B in the chat for this question. No problem. Which is lactate, alanine, and glycerol. This I just pulled directly from your slides. Also, these all convert to pyruvate, which can enter gluconeogenesis. Yeah. If you go to the next slide, it shows that more. This is just the pathway that they take to convert to pyruvate and then eventually become glucose. Another gluconeogenic precursor would be propionyl-CoA, which is from fatty acid metabolism, but that would just be involved with like odd chain fatty acids. All right, next question. 7-year-old child is being evaluated for recurrent hypoglycemia during periods of fasting. Laboratory studies show impaired gluconeogenesis. Genetic testing reveals a defect in an enzyme located in the mitochondria that requires biotin and converts pyruvate into oxaloacetate. Which of the following molecules normally serves as an allosteric activator of this enzyme? Okay, so I'm seeing some E's. All right, yeah, E is the correct answer. So the enzyme we're talking about here is pyruvate carboxylase, which if you go to the next slide, converts pyruvate into oxaloacetate, and it requires carbs, lipids, amino acids. Those can all feed forward the pyruvate carboxylase enzyme by a positive feedback mechanism of acetyl-CoA. And then obviously pyruvate carboxylase needs ATP and requires biotin in order to function. Okay.
All right, hello, I'm back. We're gonna go over glycogen metabolism now. Okay, so the first question, a 20-year-old athlete is running a marathon. During exercise, glycogen stores are mobilized in both the liver and skeletal muscle. Which of the following best describes a key difference between glycogen metabolism in the liver compared with skeletal muscle? All right, I'm seeing a lot of B. Does anyone want to explain why that's the right answer? Because someone said so before in the chat. Fair enough, yeah. So essentially, the liver's main role is systemic energy supply, right? Especially for the brain and other tissues during exercise and fasting. So, for example, for A, right, it's actually backwards. So the muscle can't release glucose into the blood because it lacks, yep, like you said, it doesn't have glucose 6 phosphatase, and the muscle glycogen is being used locally to make ATP for contraction. So that's why C is also going to be wrong, and then D is also wrong because epinephrine is stimulating glycogenolysis in both the liver and muscle. All right, we'll move on to the next one. Yep, that's pretty much going over what I just said. All right, a patient has just finished a large carbohydrate-rich meal. In hepatocytes, insulin signaling leads to activation of glycogen synthase. Which of the following best explains the purpose of glycogen synthase activation in this metabolic state? All right, looks like everyone said E, which is the correct answer. Because after, a carbohydrate-rich meal, your blood glucose is going to rise. So the insulin signals the liver to store that excess glucose as glycogen using glycogen synthase. That's making sure that the glucose can be saved for your body's, need for energy later on, rather than letting that blood glucose stay elevated. And just to go over why the other options are incorrect, so A, to increase glycogen breakdown, which supplies ATP to skeletal muscle. That's going to be incorrect, right? Because glycogen synthase is building glycogen, it's not breaking it down. And for choice B, we know that it's partially related, but it's not the primary function of glycogen synthase. And then for C, we know that gluconeogenesis is occurring mainly during fasting or low blood glucose levels, right? Not after a carbohydrate-rich meal. So insulin would be inhibiting gluconeogenesis, so that's incorrect. And then for D, to stimulate lipolysis and ketone body formation, that's going to be the opposite of what insulin does. Insulin is going to be inhibiting lipolysis and ketogenesis after a meal. All right, so hopefully that's pretty straightforward. And then again here, just reinforcing that glycogen synthase is activated during the well-fed state and inhibited during fasting. It's important to remember. All right, next question. During intense exercise, glycogenolysis in the skeletal muscle is rapidly activated to provide ATP. Which of the following molecules acts as an allosteric activator of muscle glycogen phosphorylase, stimulating glycogen breakdown? Amazing. It looks like you guys have got that one down. It's AMP, right? Because AMP is going to be accumulating when your ATP is low during intense exercise. So AMP is going to allosterically activate muscle glycogen phosphorylase, stimulating the glycogen breakdown to produce ATP. And then just to go over, the other ones like we have listed here. So ATP is going to be signaling high energy, right? So high ATP would inhibit glycogen phosphorylase because the muscle doesn't need any more energy. And then for glucose 6-phosphate, when the energy is plentiful, you're going to have a lot of glucose 6-phosphate. So it's going to inhibit glycogen phosphorylase as well in muscle to prevent, unnecessary glycogen breakdown. And then citrate is also, when you have high energy and an abundance of nutrients. So citrate's generally going to inhibit glycolysis, not activate glycogen breakdown. And then NADH reflects, high reducing power. So if you have high NADH, that means you have a sufficient amount of energy and you would not have to activate glycogen breakdown. And correct, Abby, yeah, calcium would also be stimulating glycogen breakdown. All right, so if that's good, let's move on. Okay, a 6-month-old infant presents with severe hypoglycemia, hepatomegaly, and lactic acidosis. Biopsy of the liver shows normal appearing glycogen with increased amount. The deficiency of what enzyme is most likely responsible for this condition? Interesting. It looks like we're seeing a mix of B and C in the chat. So these clinical correlate questions are really important. Can someone explain to me why it would not be B? And what in the question stem can kind of tell you that it won't be B? Exactly. Yeah, Maya, it appears normal. So that is a really good, statement in the question that's going to rule out the debranching enzyme or the branching enzyme, especially because, the glycogen structure is normal in our patient. So it is, in fact, C, glucose 6-phosphatase. And again, liver glycogen structure is going to be normal in von Gierke disease, but it cannot convert that G6P into glucose. And so those symptoms obviously are going to present with severe fasting hypoglycemia, hepatomegaly, because you're having an accumulation of glycogen, and you're also going to present with lactic acidosis, uricemia, hyperlipidemia, things like that. And yeah, perfect, Amy. Debranching is Cory's disease and it's normal, so it can't be B. Make sure you go over all of these diseases. They definitely love to ask about at least a few of these, and it's important to know like clinical presentation and just know all the different factors correlating with them. All right, let's move on to the next one. So now we're going to go over mono and disaccharide metabolism. So a 6-month-old infant is introduced to solid foods containing fruit and honey. Shortly after feeding, the infant develops vomiting, lethargy, sweating, and seizures. Lab studies reveal hypoglycemia and hepatomegaly. Which of the following enzyme deficiencies is most likely responsible for this presentation? All right, looks like most people are right. It is B. Does anyone want to explain why it's aldolase B? Sylvia, memorize it once in your life. Yeah, honestly, fructose intolerance is aldolase B. Yeah, exactly. So this is, clear presentation of hereditary fructose intolerance. So because of that deficiency in aldolase B, you're having an accumulation of your fructose 1 phosphate, and because of that, you have a decrease in phosphate, and that's going to be also, you're going to have a decrease in ATP, and as a result of that, you won't be able to go through gluconeogenesis and glycogenolysis, and because of that, you would present with the severe hypoglycemia after the fructose ingestion. Okay, next question. A 25-year-old woman develops bloating, abdominal cramping, and diarrhea about 30 to 60 minutes after drinking a glass of milk. She reports no systemic symptoms such as jaundice or hypoglycemia. Which of the following best explains her condition? Amazing. Yep, this one's pretty straightforward. I'm sure all of us know someone or are have lactose intolerance ourselves. But yeah, this one. So for lactase, we know that that's breaking down lactose into glucose and galactose, right, in the small intestine. And so if you have a deficiency in that, then the lactose is staying in the lumen. So that's going to result in those symptoms of osmotic diarrhea, gas, bloating, and it's going to be localized to the GI tract, which matches our scenario in the question. Make sure you're familiar with all of these deficiencies as well that are listed. All right. A patient with poorly controlled diabetes develops blurred vision and peripheral neuropathy. Which biochemical pathway explains the accumulation of sugar alcohols in tissues like the lens and peripheral nerves, contributing to these complications? All right, yeah, it looks like most people got the right answer. It is B. So some tissues, especially, like the lens and nerves, have very little of that sorbitol dehydrogenase. So when glucose is converted to sorbitol, but sorbitol to fructose is slow, because of that, you're going to have an accumulation of sorbitol, and it's going to present with those symptoms like blurred vision and neuropathy in this case. Any questions about that? And that's the pathway again. Make sure you know these. We can also find these on the map. So the map, again, reinforcing this, it can help you with like at least half of the questions, honestly. If you're able to find these enzymes on the map, it'll definitely at least help you rule out the answers. Okay, now we're going to do the PPP and NADPH lecture. So which of the following best describes the primary purpose of the pentose phosphate pathway in human cells? Yes, Kimberly, the map is on Canvas. It should be, I remember for us at least, it was like at the top of the modules page. Definitely use that while you're studying. That way it'll be easier for you to, find things when it comes to test day. You'll already kind of know where things are located, at least generally. All right, yep, everyone's got the right answer. It is B. So the main purpose is that it produces NADPH for biosynthesis and ribose 5-phosphate for nucleotide synthesis. So going over the other answer choices, so for A, PPP does not produce ATP, right? What are some pathways that are going to produce ATP? Should be a pretty easy question. Yep, glycolysis, ETC, yep, oxidative phosphorylation. And then for C, the conversion of glucose 6-phosphate into glycogen, we know that that's glycogenesis, right? Not PPP. And then for facilitating the breakdown of glycogen to glucose 1-phosphate, that's going to be glycogenolysis. And then for E, what pathway is that? Yep, you guys got it, beta oxidation. So again, even a question like this, you could go on the map and literally see like what the products of each pathway are and be able to like rule out answers that way. Good job there. Let's move on to the next one. Okay, a 48-year-old man with a history of chronic alcoholism presents with confusion, unsteady gait, and double vision. He has poor dietary intake and has recently been receiving IV glucose for his hypoglycemia. Which of the following best explains the pathophysiology of his neurological symptoms? Amazing. Yep, you guys got it. It is B. Does anyone know what condition we're talking about here in this question? Yep, Wernicke's. And one important word I would say to point out is the alcoholism. Like Fionn said, thiamine deficiency can be caused by alcoholism, so those two are linked. So again, just reinforcing that thiamine is an important cofactor for pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and transketolase. Again, you can see those on the map. The map is really helpful for cofactors, especially it'll say it on there. And then I think in the bottom left corner, it'll give you the names of all the cofactors as well, if they have like the vitamin associated with it. And so gluing glucose without that thiamine is going to increase the demand for those thiamine-dependent enzymes. And because of that, it's going to lead to neuronal energy failure, and it's going to result in that Wernicke's encephalopathy. Okay. All right, so last question I think for this section. Glucose 6-phosphate is a central metabolite in carbohydrate metabolism. Which of the following lists correctly describes its primary metabolic fates? And I would definitely say they love to ask questions like this where there's a lot of similarities in the answer choices, and you really need to know every detail to be able to answer the question correctly. I know, I'm sorry, Amy. It's so real though. I feel like whenever we get questions like this, I'm staring at it for like 20 minutes. But yeah, just reinforcing, like Kevin said, make sure you read the answer choices carefully. And it's like testing your knowledge for multiple different pathways in one question. All right, so it looks like a lot of people are saying D, correct? And yeah, Alana, you can get this answer in the map too. Once again, reinforcing a lot of questions, the map will definitely help you. So use it to your advantage. And if you go to the next slide, there's a good visual of all the different pathways. Yep, so glucose can be used in glycolysis, obviously, glycogen synthesis, the PPP, and glucose release via glucose 6-phosphatase. Amazing. All right, that's it for my section. Good luck, guys, on the exam. You got this. And email us if you have any questions.